Thank you, Mr. Chairman, and Dr. Frieden, thank you for being here. Thank all of you on the panel for being here today. You know, this is not about politics. It's not about international diplomacy. It's about public health and protecting the public safety of the American people, particularly our health care workers who, if I understood correctly, you've acknowledged are some of the high-risk folks to be exposed. You know, one of my main concerns, Dr. Frieden, is that we don't know what we don't know. Throughout testimony and questioning today, I've heard you say multiple times, I don't know the details of this. I don't know the details of that. And I think what the American people are wanting is some assurance that somebody does know the details. So let me ask you a question. Do we know yet how the two healthcare workers in Dallas were contracted the virus? Was it a breakdown in the protocol? Was it a breakdown in the training of the protocol? Do we know whether or not the protocol works?
The investigation is ongoing. We've identified some possible causes. We're not waiting for the investigation to be completed.
So we don't know.
We're immediately implementing safety measures.
I get that. We don't know. You know, the people in Ohio are concerned, especially now that we know that one of those health care workers traveled through Ohio, even spent some time in Akron with family members. I applaud Governor Kasich's immediate actions to try and address the situation. You know, in my experience as a military war planner, 26 and a half years in the military, and I know we've got military engaged in this process overseas, we don't wait until the bullets start flying to figure out whether our war plan is going to work. Dr. Frieden, when did the CDC find out that there was an outbreak of Ebola in West Africa?
Late March.
Late March. Has there been, one of the things that we do in the military is that we conduct what's called operational readiness inspections. We give real-world scenarios in controlled environments, no notice, so that those who are going to be responsible for executing a war plan knows what to do when the first shot is fired. No panic, no second guessing. They know what to do. Has the plan to address an Ebola outbreak ever been tested by the CDC in a real-world environment?
Not only has the plan been tested, but outbreak control has been done multiple times in parts of Africa. What had not been done is in this part of Africa, which had never seen
No, I'm talking about here in America.
In America also, we do a series of preparedness plans, for example.
Which, do you know of any hospitals in eastern and southeastern Ohio that have participated in any kind of real-world scenario of an Ebola outbreak?
I can't speak to that specific example, no.
Okay, let me go a little bit further. You mentioned earlier that 150 per day, roughly, are coming in from West Africa. I think Mr. Wagner indicated 94% screening. Let me give you a scenario. Let's say a person comes in to the country from West Africa, and let's assume that everything in the screening process works right. They're maybe in day 14 of having been exposed to Ebola in West Africa. They show up here in America with no symptoms. They go through the screening process, and so they go on about wherever they go, Akron, Cleveland, Cincinnati, Los Angeles, wherever. Day 17 or 18, they start getting ill, and they start seeing a spike in their temperature. If they walk into any emergency room in Appalachia, Ohio, and start throwing up, having symptoms, does your plan identify that? And does your plan tell that hospital emergency room, what to do in that scenario. They don't know that person came from Liberia or any other place.
We have detailed checklists and algorithms that we've distributed widely, provided repeated trainings and information so that healthcare providers throughout the country have a detailed checklist of what to do step by step by step to determine whether the person has Ebola. If they do, to call for help, and we will be there.
Okay. Mr. Chairman, I yield back.